Hey guys, it's Dr. Lisa coming to you from Tampa, Florida, where we are here on the front lines as a very busy primary care practice specializing in integrative and functional medicine, handling the calls as they come in, virtual visits for sick patients, and still working in the trenches daily to keep our patients healthy and informed. And I really felt moved when this started to bring this to the broader public. Kind of the way that I like to interact with my patients is empowering. I try to provide information enough so that you don't become overwhelmed, but that you're knowledgeable about what's happening, and then give you practical tools and tips to empower you to take back your own health. And I think we're in an unprecedented time of the ability to do a lot of these things. So in terms of my update for the virus and research on COVID-19, I like to start with that. Those of you that are new, that are following me, I'm starting with a tip and summary about the virus, and then going into how I like to prep the body and heal, and things that you can do that are practical. And then I'm trying to end with a positive affirmation. So one of the things that came out in some research yesterday that I found really interesting, and it was correlative to patients that I was seeing virtually, is that the time frames with this virus have still been really uncertain. So the best we can tell as of now is that the time between exposure and the onset of symptoms, the average is about 5 days. So if you're concerned, you traveled, you had around somebody that was sick, even maybe they didn't have COVID-19, but you're not sure, usually within 5 days would be when you would start having symptoms that would kind of give you a clue that something was going on. So 5 days onset to symptoms, the average length of symptoms is about 8 days. During that 8 days, the severity would typically increase if it is going to. And again, remember, most people are asymptomatic or very mild cold symptoms with this virus. So, I've talked to multiple patients or calling me or reaching out through the portal, and we're having visits about, how much longer, when is it going to act up? Am I going to get worse? And again, this isn't for everybody, but the average time before more severe complications would set in is within 3 to 4 days. So if you have had a naggy cough, or you had a fever once, a week and a half ago, but you're feeling better now, chances are it was not COVID-19, okay? Even if it was, you're not likely to get worse. So the tricky part comes in, again, in the diagnosis, and with fever, that's probably the biggest tool to look for, because 87% of patients have had fevers, and they can be at times pretty high. Cough is the second most common symptom. We talked yesterday on this live about anosmia, which is the sense of smell, which is coming up as high as 60 to 70%. Losing sense of smell with a fever and viral illness is fairly diagnostic from my standpoint. So then the question comes in, and I had a patient yesterday who we did a virtual visit, and she sounded like symptomatically like she may have had COVID-19, and she was just asking me about her 82-year-old dad, and when should she feel safe seeing him. And this is another big new game for all of us in medicine and the world, is this virus can continue to shed after your symptoms are gone. So this is a little bit rough. Studies have shown anywhere from, I think it was 5 days up to 8 to 10 days, asymptomatic patients still showing virus in different secretions in a study that they did. It was a small study, so again, this data is coming out all the time, but if you have a very high-risk relative, if you have to, that you have to care for, you're gonna have to put that off, in my mind, for at least about 8 days after symptom resolution. Let's talk about a practical tip now. The virus also is, most of you have heard about this now, but it can hang around on plastic and cardboard. So make sure that and surfaces in general. So make sure you're not getting complacent, and get a bleach to water solution of 5 or 10 to 1 and spray your countertops down, your knobs, your doorknobs. I am going to give you one super awesome practical tip, because I broke my key to my door in my garage. I broke the lock I was spraying the bleach water solution, and apparently it calcifies, and then you can put your key in. Luckily, the locksmith, who was not willing to come to my house, interestingly, I only called one, but he was great, and I've known him for a long time, and he told me the solution to get, which is some lock ungluer, to put in there and wiggle my key in, and I got it dislodged. So don't spray it right up inside the hole where you put your key. Okay? Now, what I wanted to talk about is during this time that you guys potentially could have, whether you're home quarantined or you do get symptoms and you're nervous to go out, we want you to do something practical to dig in. And one of the tools that I have found with my patients through the years that works really well is journaling. So you have a pad around the house. You won't have to get out of the house. Grab it, and both my men and women, so my male and female patients, have been able to kind of sit with this and do it. It's quick, it's easy. What you want to do is potentially, if you can get a spiral notebook, that's even better. So at night, before you go to bed, we want to invite in the energy of what we all are looking for. So I am happy, I am healthy, I have all the money I need, I have a job that I absolutely love, my relationships are amazing. You can write it like you are in La La Land, you know, you're painting your life with a paintbrush, it's perfect. But I want you to write it as if it has already happened, okay? So that's the positive affirmation or positive statements that you're gonna write before bed. And we're all energetic beings. So at night, when you sleep, you've invited in all this energy, the energy of love and what you want to be and what you want to see in your life. And then in the morning, turn the page and just give yourself a minute. So this, you don't have to talk to your partner or your kids about what you're doing. Just take the notebook, go find a corner and purge. So that's the place. Take these emotions that are coming up in this void that we're sitting with of time and space. So take them and write. I don't know what to do. I am not getting along with my partner. They're driving me crazy. I am so tired of feeling terrible. When am I going to find somebody to help me? If I hate my job, you know, get all of that, get it out, put it on the paper, and then rip it out, rip it up, and throw it away. Okay, so you'll be left with a notebook that just has positive, awesome things in it, so that even if somebody finds the notebook, it's just positive and happy. And you've cleared and purged an open energy to allow some of the good to come in. So this simple exercise, both men and women, it's very easy to do. I've had really amazing results with my patients coming back talking about their journaling experiences. And so try it, and please leave me a note below if you did and what happened. I am truly enjoying spending these morning times with all of you, and I appreciate the shares so I can reach more people. And that's about it for today, other than our affirmation. So the affirmation for today is, I am connected to my mind, my body, and my emotions. I am connected to my mind, my body, and my emotions. Stay connected, kind of explore the uncertainty, wipe off your countertops, stay away from, at-risk loved ones if you've had symptoms, and, I look forward to being with all of you again tomorrow. Have a great day.